Hello, from Melbourne, Australia. Firstly, I would just like to send my apologies that this presentation is pre-recorded. Due to some personal circumstances, I'm unable to present to you live, but I'm extremely grateful to have the opportunity to share my experiences regarding COVID-19. It's a privilege to present to you at the International Nursing Conference of Clinical Alemana, Santiago, Chile, and I would like to make special thanks to the conference organisers for their incredible commitment to bringing together such a wonderful group of speakers to reflect on these incredibly challenging times. I think both personally and professionally living in a pandemic. So, firstly, I would just like to give you all a bit of a background about my country and where I live. So, I will refer you to the first slide. So, I come from the land down under. So, despite our great size, our population sits at approximately 25.5 million people. As you're aware, Australia is an extremely large island, the smallest continent but one of the largest countries on Earth, and we lie between the Pacific and the Indian Oceans in the Southern Hemisphere. So this low population density of the 25.5 million people is generally attributed to the semi-arid and the desert geography of much of the interior of the country. So it's actually estimated that approximately 90% of our population live on the coastlines of Australia. So Australia, as you can see, is divided into 6 states and 2 territories. But for today's presentation, I'll be speaking about my own state in Victoria, which is, you can see, the very bottom of the map in that red colour there. I'll move you on to the next slide there. So a closer picture of Victoria and my hometown, which is Melbourne. So Victoria's population is estimated at 6.5 million people. Our state capital, Melbourne, is home to just shy of 5 million people. So again, you can see, and when we say Melbourne, we generally speak, you can see that Bay region there on the map. We speak sort of as Melbourne as really along that coastline of the Bay, whereas the rest of Victoria is much more of a rural type community, but you can see that the populace is very much clustered around that capital city. So where do I work? So for the last 10 years or so, I've had the great fortune of working with a healthcare provider here in Melbourne called Cabrini Health. So Cabrini Health comprises a network of hospitals, both acute and rehabilitation. We also have one residential aged care facility. So across all of our hospitals, we have 832 beds in our care. It's a not-for-profit health service, and we really pride ourselves on delivering world-class healthcare across a variety of specialties. So our acute hospital, which is pictured here in Malvern, is probably a 10-minute drive from the CBD, or the Central Business District in Melbourne. And this particular hospital is really well regarded for its, sort of generalist type medicine healthcare, and also, peri-op, and also they have quite a large maternity service. And you can see from this picture here that there is the original old hospital has been recently renovated, and it's got this exquisite Gander wing, which was a generous donation of one of the many families that contribute to our foundation, and it's just stunning. So not only a beautiful place to work in terms of its community and its commitment to patient-centered care, but also a really lovely place to work in aesthetically. Just moving on to the next slide, so a bit more about Cabrini and our values. So our values form the base of our mission, and they were built or drawn from Mother Cabrini's life, and they reflect her heart and her spirit, her conviction and her approach. So in everything we do at Cabrini, we centre ourselves on these values, that is compassion, integrity, courage and respect. We strive to meet the healthcare needs of the community with a deep commitment to progress and show leadership. So, as I just briefly mentioned, I don't actually work really across the main hospital, which is the one that was pictured on that original slide. So if we move across to the next slide, you can see the title, Cabrini Palliative and Supportive Care. So Cabrini's Palliative and Supportive Care is a unique service which has the ability to anticipate and respond to individual needs of patients living with terminal or life-limiting illnesses. We provide palliative and supportive care through hospitals and health facilities, in the home, and specialise in complex symptom management at the Cabrini Paran inpatient unit. So both of those photos that you see there, the one with the fireplace and the one with the cars out the front of the building, that is our Cabrini Paran inpatient unit. So this is a 22-bed unit, which is specifically for palliative patients. So again, patients that are either imminently dying or in the final stages of their illness, or are receiving complex symptom management for their advanced illness. So that can be things such as pain management, nausea management, those types of things. So we're a very regarded service, and we're a very unique service. It's a place or a hospital like no other that I've ever been to. It has a very home-like feel about it. So it's centered around this sort of lounge communal area, and each of the bedrooms has capacity for family members to be able to stay with them, 24 hours a day. They're quite large, spacious rooms, and they've all got their own private bathrooms. So that it really is a beautiful hospital, which caters for a lot of people when they are in those last stages of life. So I'll just take you back to a snapshot of what COVID has looked like in Australia. So if you just go to the next slide, it says a snapshot of COVID-19 in Australia. So this is something that I've taken from the government Department of Health, and it really is exactly that. It's a snapshot of how COVID-19 has affected our country. So you can see in the top left the current status of confirmed cases. So we've had in Australia a relatively low number compared to the bulk of the rest of the world, really. We've had 27,821 cases. Of those cases, we've had 907 deaths. So you can see there our daily number of reported cases. The graph that we in fact did encounter a second wave, as I know a lot of other countries in the world have experienced or are starting to experience now, sadly. And I'll just move you through to the next slide because as I wanted to really talk about today, I wanted to talk about the Victorian experience because Victoria, where I live, has undoubtedly been the most impacted by COVID-19. So you can see there, this is Victoria's graph of case numbers of COVID-19. So really, at the start of March, we started getting some numbers. At the time, I was working not in the inpatient setting, but working as a community palliative care nurse. And I won't lie, it was scary going into people's homes and knowing that, this disease was, rapidly increasing day by day. And so I made the choice at that time to lock down earlier than the government actually enforced restrictions. I did so because my son has some significant health issues. So we, not knowing, how this disease could affect children or vulnerable children, we made that decision. So I didn't work during that period. I took a leave of absence. But I'll just move on to the next stage, so how Victoria's managed COVID-19. So on the 28th of March, hotel quarantine for all returning international travellers was declared to commence. So that quarantine, what it looked like was a 14-day period where return travellers would be taken to hotels across Melbourne, and they would be forced to quarantine for a period of 14 days. Stage 3 restrictions were implemented, and we were given only 4 reasons to leave our home. So we were allowed to work and study if we were unable to do so from home. We were allowed to go shopping for food and other essential supplies. We were allowed to provide care to those who needed care, and we were allowed to exercise for a few hours a day. So that was lockdown number 1. But as the curve flattened, as you can refer back to that original graph, so schools started to reopen, which was wonderful. As you know, I'm sure many of you have encountered homeschooling and trying to juggle, working from home, etc. It was certainly a very tricky task to manage. But so schools thankfully reopened. We've had very significant large-scale testing here in Victoria. Gatherings were increased to up to 20 people allowed in the home, and dining in resumed with limited numbers, and obviously observing very strict social distancing. But sadly, so I'll just show you this next slide here. You can see an elderly resident being moved out of a highly contaminated care facility, an aged care facility in Melbourne. So COVID-19 numbers started to dramatically climb in Victoria, but the devastating part of this was that, unfortunately, when it got into the aged care sector, we knew that there would be inevitable fatalities, and unfortunately, because of the way that a number of our aged care facilities work, and the workers, are often shared across multiple sites, it became, several clusters within these facilities very, very quickly. So it was very, very sad. just another graph for your reference, and again, this is just Victoria. So the mode of transition, so was it acquired in Australia? Was it an unknown source? Was it acquired overseas, or was it unknown? So you can see that the bulk of the cases in that massive second wave were in contact with direct cases related to these aged care outbreaks. So on the 2nd of August of this year, Victoria entered into a state of disaster. So this is a picture here of our Victorian Premier, Daniel Andrews. On the 22nd of July, he announced that all Victorians would be mandated to wear face coverings, and on-the-spot fines of $200 would be issued to anyone that was non-compliant with that. So we've been living in masks now since, yes, the 22nd of July. So stage 4 restrictions, what did that look like? So remote learning was reinstated. We had a curfew. We were not allowed to leave our homes after 8 o'clock at night or before 5 a.m. in the morning. We were not allowed to be outside of 5 kilometres away from our home unless we were having a specific workers permit or grounds for compassionate reasons, etc. Recreational activity was ceased, and exercises was only allowed for 1 hour a day, and only one person per household was allowed to go to the shops for food supplies. So stage 4 restrictions are obviously very difficult time for many Victorians, not being able to see loved ones for extended periods throughout the year has been extremely challenging for not just myself but for all Victorians alike. So what happened? Why was Victoria the only state to experience this second wave? Well, sadly, this can be attributed to our failed hotel quarantine. So there are reports of the hotel quarantiners being able to leave their hotel for shopping, very poor training of security guards, not being trained correctly on the donning and doffing of PPE, and then, inevitably contracting the virus themselves and then taking the viruses back into their communities. And then obviously we've seen that it's gotten into the aged care sector here in Victoria. But, and that's a very happy but, as of the 23rd of November this year, we've had 1 active case. That's when I wrote this presentation. We've now had 0 active cases in Victoria. So throughout, doing the hard yards, working from home where we could, homeschooling, not being able to see friends and families, not being able to exercise in your regular fashion, we have achieved 28 days of COVID-free here in Victoria. So something that we are collectively incredibly proud of. And yeah, I am just so grateful for the opportunity to do things that I did used to take for granted. So the restrictions continue to ease. The ring of steel separating Melbourne from Greater Victoria was lifted. We're now, other states have been reopened to Victoria, and we are effectively living in what the government has donned a COVID normal. So we will continue to practice safe social distancing and continue to implement strategies that the government have put in place to hopefully keep us COVID free. But I think more significantly, if COVID does come back into Victoria, hopefully we'll be able to learn from the mistakes that were made with us experiencing the second wave and not see the devastation that we did see. So for me, how has this affected me as a nurse in a palliative care unit? Well, as I said earlier, COVID's impacted my professional life, but it's also deeply impacted my personal life. The enforced visitations, restrictions in our palliative care unit left me feeling entirely helpless. As you are all aware as nurses, it is a duty of care to provide effective communication, to provide support, to provide access to care. And I felt that because our visitor restrictions were so intense, I found it was very challenging to nurse people who were, in their final days, in their final weeks, knowing that they were feeling so alone and not being able to give them that comfort. And more so, for the family and the friends that were at home and not able to be with them, I just felt that it was hugely unfair. Obviously, this was not a decision that was made lightly. It was a decision that was made to protect the staff, to protect the patients, and to try and deliver the best care we could. But it didn't take away from the deep impact that it had on the nursing team. As you're all aware, PPE, it's a taxing process to put it on and take it off. It's a taxing process to shower someone when you're in full PPE physically. But I really feel as though the PPE, more than anything, really impacted and created a barrier where I felt I was unable to connect with my patients. So personally, like so many, I have a new perspective on appreciating the smaller things in life. Hard lockdowns and personal circumstances have grounded the need for me to put my family first, and I think realistically, if I reflect on the lessons that I've learnt this year, is that we need to appreciate each and every day. That is absolutely the forefront of my mind now. And when I say appreciate, I need to be present in every moment and present in my family, because we don't know. We don't know when things like COVID are going to happen, and suddenly you're in a position where you can't see your mother for 6 months. It's been really hard, but it's been really enlightening. And I love my role as a nurse, but ultimately this year has taught me that being a nurse doesn't define me. It's a part of me, it's a strong part of me, but there's more to life than work. And I'm really grateful for have learnt that. I'll just take you to the slide of that beautiful sunset on that beautiful beach. So I'm very, very fortunate. I can walk to this beach in just 5 minutes. It's just 5 minutes away from my home. And I can now see my extended family, and we can walk on that beach together, and we can breathe that fresh air and know that we're COVID free and feel safe in our community. So I'm so blessed that I can take my boys and play on that beach, and look forward to many happy days there coming up over summer. And I've just written on the slide, come and visit any time, and I mean that sincerely. I would love the opportunity to connect and to share my beautiful home. So what are my professional goals? I'm really, really hopeful as a researcher to document the lived experience of nurses that worked in a palliative care unit amidst this pandemic. So I believe that there are so many great lessons to be shared, and that this fraction of history will help us to be better nurses and to be better people. And thank you all for listening.